We live in a society where drinking is normal. It's almost a rite of passage, a celebration, a habit that marks our free time, social moments, even grief. But have we ever stopped to ask why alcohol, a psychoactive and toxic substance, is so deeply rooted in our culture? We're not just talking about addiction. We're talking about perception, about how alcohol is romanticized, normalized, even recommended in small doses. We're talking about how a poison became acceptable. What happens when we drink alcohol? As soon as it's ingested, ethanol quickly passes through the mucous membranes, enters the bloodstream, and begins acting on the brain. It inhibits the prefrontal cortex, the seat of rational thinking and impulse control. That's why we feel uninhibited and more sociable. But this euphoric effect is only the beginning. Next comes sedation, mood decline, memory impairment, and often a rebound of anxiety. Alcohol is a psychoactive substance. It acts on the central nervous system. It causes tolerance, dependence, withdrawal symptoms. And yet we don't treat it like a drug, even though on a neurochemical level, its mechanisms are similar to heroin or cocaine. The difference? Alcohol is socially accepted. The others are not. The data is clear. According to the TOU, alcohol causes over 3 million deaths every year. It's linked to more than 200 diseases. It increases the risk of cancer, liver disease, mental disorders, and suicide. And yet, despite all this, it remains a normal substance, almost invisible in its danger. What does psychology say about all this? Many people drink to regulate their emotions. Alcohol becomes a refuge, an escape route. Those who suffer from anxiety, depression, or chronic stress are at higher risk of problematic drinking. But the illusion that a drink can calm or help switch off the mind is dangerous, because in the long run, alcohol worsens the very emotions it seemed to ease. And on a social level, drinking is normalized in every context: parties, happy hours, weddings, even sports events. Those who don't drink are often seen as weird, uptight, or boring. This social pressure fuels self-deception. If everyone does it, how bad can it be? But the truth is, this normality is constructed. Alcohol marketing is powerful. Advertisements convey seductive messages. Drinking means success, charm, relaxation. But behind these images is an industry profiting off addiction, shaping public perception. Just like tobacco once did, once glamorized, now known for causing cancer. And young people. More and more teens start drinking at an early age. The culture of binge drinking, drinking to get wasted, is on the rise. The developing brain is especially vulnerable, and each drink leaves a mark on dopamine pathways, memory, and emotional regulation. But what makes alcohol so hard to criticize? The answer lies in culture. It's tied to our identities, our rituals, the way we socialize. Questioning alcohol means questioning a way of life, but this is precisely where psychology can make a difference. We need a paradigm shift. This isn't about demonizing those who drink. It's about informing, showing the other side of the coin, creating awareness, because only those who truly understand the effects of alcohol can make free choices. Alternatives exist. Drinking isn't the only way to relax, have fun, or connect with others. But as long as we keep portraying alcohol as a need, we'll never develop new models of socialization. And this is where mental health comes in, because a conscious mind is a free mind. And those already struggling with addiction. Alcohol dependence is not weakness. It's a complex, multifactorial disorder. It requires support, empathy, therapy. Willpower alone isn't enough. Psychological and sometimes pharmacological interventions are needed within a non-judgmental environment that offers understanding. understanding. Conclusion: alcohol is a toxic substance. There is no safe amount. Even small doses increase health risks. It's time to stop glorifying it. It's time to break the myth of the healthy glass. Because mental health also begins with the choices we make when we raise our glasses. The first step is to look with new eyes at what we once took for granted and ask ourselves, am I truly choosing or just following a social script?